Okay, good morning, everyone. My name is Tracy, and I'm one of the co-leads for the Women with Heart Online. I'm sitting in for Lisa today, and it's my pleasure to introduce Dr. Carolina Carvalho this morning, who will be presenting on medications and updates, as well as doing a Q&A session as part of her presentation. We're really excited to have Dr. Carvalho. As many of you may know her already from the program, but Dr. Carvalho has over 10 years of experience as a cardiologist and has been with our program for the last couple of years and has a specialty in cardiovascular prevention and rehabilitation. So we're very excited to have her here with us this morning. She was with us previously, so she's returning for a return presentation. We thank you, Carolina. And I will turn it over to Carolina now for her presentation. Thank you.
Thank you, Trace. So good morning, everyone. It's really a pleasure to be here. And I want to thank Tracy and Lisa very much for this opportunity. So let's start. Okay. So I will talk today about medication, and we will also have a Q&A at the end. So start to think about your questions, make some notes, and then we will talk at the end. I hope that by the end of this session, you will know some common classes of heart medicines, resources that can help you manage your medicines, and then you'll be able to talk to your doctor or your pharmacist about your medications. Let's start from the beginning. So before we start talking about medication, I wanted to talk a little bit about the heart, okay? It will help you to understand the medications later on. So the heart is fantastic. It's multitask. We can compare the heart to a house with at least 3 systems. So the first system is represented here on the left side by a pump. So you can think about your home and a water pump. So the heart can have this function, bringing water to the whole body. So in this case, the heart is bringing blood to the whole body. And it has valves, and it has chambers, and all need to work very well in order to work properly. If someone has what sometimes is called weak heart, then there will be a problem in the pump. If there is a problem in the valves, same thing. Maybe this person may have a problem in the pump. Now on the second system, on your right side, you can see the electrical system of the heart, and think about your home. So same thing. We have here the sinus node. So here the electrical signal is generated going down to the atriums and ventricles. And then this electrical impulse will bring energy to the heart in terms of electricity, and we would say to the muscle, oh, it's time for you to contract, so the muscle can contract. Every time there is a problem here, usually we are talking about arrhythmias, then we are talking about electrical problem. Same thing, think about your house. And finally, the third system, we have the pipes. So think about your house. It's impossible to have a good house if working well, if there is a problem in the pipes, if there is, you have the pump, but there is no pipes to bring the water, right, to your house. So similar here, for the heart to work, we need to have coronary arteries, which are these arteries. So they are bringing blood for the heart, so the heart can work very well. Similarly, there are other arteries, and here is, you can see the biggest artery in our body, the aorta, which will bring blood to the whole body. But I would like you to pay attention here to the coronary arteries, bringing blood supply and oxygen to the heart muscle. So every time you are talking about someone with a heart attack, we are talking usually about these systems with a kind of problem. And what happens, as you know, with cardiovascular risk factors, age, and other things, we may have some plaques building up in the coronary arteries inside them. And then if it's too big, or if there is a rupture in the wall of this plaque, then a heart attack may happen or angina, and then it may be requested to be fixed with surgery or a stent placement. That is something that is placed inside your artery, coronary artery. First, there is a balloon that is open, and then later there is this metallic piece that is open, smuggling the plaque, and open again the flow for the blood flow to be reestablished. Okay, so why am I mentioning that? Because these medications will affect all these systems. Okay, so very importantly, I wanted to start saying that before anything, I wanted to start to highlight that I'm presenting some examples of common classes of heart medications. This is not a complete list, but you can access it on our Cardiac College website, and I will show you exactly where at the end of these presentations, okay? So, first, let's talk about antiplatelets, also known as blood thinners. So, as you can see, this class of medication is going to act on the pipes. You know probably very well the aspirin or acetyl salicylic acid, and there is another class called here represented by clopidogrel, ticagrelor, and prasugrel. So usually after a heart attack or a heart intervention, people are placed on aspirin, and for a certain period of time on clopidogrel or ticagrelor, or let's use it prasugrel. What is the action of antiplatelets? So it prevents the blood platelets, these tiny cells here inside the coronary arteries, from sticking together and forming clots that may cause a heart attack or a stroke. As you can see here, these tiny cells are in the blood flow, and then when there is also the plaque and a plaque rupture in the bottom, you can see that these cells go to the plaque, and then a big clot can be formed. So aspirin and the other drugs help this not to happen. The second medication, class of medication that I want to mention is the cholesterol lowering pills. They are also going to act on the pipes, and they are very well known by statins. So I here represented just two of them, rosuvastatin and atorvastatin, and they are very well known to prevent liver from producing too much cholesterol. So at the end, there will be a lower LDL, the bad cholesterol, and it's also good because this medication can increase the good cholesterol, the HDL, which can protect you from a heart attack. It's also well known to reduce inflammation, and it can help you to prevent a stroke and heart attack for those who already had one and for those who never had. So, next thing, let's talk about another medication that can also bring the cholesterol down. It's called ezetimibe. Similarly, it will have an effect on the cholesterol, but now it's different. It will reduce the amount of cholesterol absorbed from the diet. And as a result, the LDL will be lower, and we are talking about the bad cholesterol. And as a final result, it can help to prevent a stroke and also a heart attack. So what happens? Usually, the first class to be prescribed is statins, but sometimes it's not enough, or some people cannot tolerate statins. So ezetimibe is an option. Okay, now we are going to talk about a medication that has effect both on the pipes and also on the pump. So I'm talking now about the ACE inhibitors. They usually finish or end with the pril, so ramipril, perindopril, and trandrapril. Again, just some examples. They are able to open up the vessels, lowering the blood pressure. They can help the heart muscle to heal after a heart attack or if weak. I'm talking here about, for example, someone with heart failure. But it's fantastic. This medication can also bring vasoprotection. What is it? So do you remember the walls of the arteries? So this medication can protect the walls of the arteries, decreasing the risk of a heart attack and a stroke. And finally, it can also be very good for people with diabetes, bringing kidney protection. Okay, but what if someone cannot tolerate the vasopril, the ACE inhibitors? So then that is an option. The option is called ARBs. They usually finishes with 10. So valsartan, telmisartan, candesartan. It's very similar to the ACE inhibitors. As I mentioned, it's prescribed for people that cannot tolerate the ACE inhibitors. Now we are switching gears to the electrical systems. So we now will talk about the beta blockers. They usually finishes with low. So bisoprolol, metoprolol, and so on. What is it good for? It's good to reduce the blood pressure and heartbeats, helping heart to work with less effort. It also helps the heart muscle to recover when it's weak. For example, after a heart attack or when there is heart failure. It also reduces the risk of another heart attack, or it helps people to decrease the angina when they are experiencing angina. And finally, it can help to control irregular heartbeats in those people with arrhythmias. Okay, we also have the nitrates or the nitro for those with angina, or also known as chest pain. We also have other kinds of anticoagulants, or as we talk, it's blood thinners. The old ones called warfarin, and we have here the new ones. And they, in short, they help also to prevent blood clots and stroke due to the blood clots. I'm not going to mention the calcium channel blockers in details, but it's also helpful to the pipes and to the electrical systems. And now I would like to highlight some points about taking medications. So everyone in Ontario who has a valid health card can go to the pharmacy and arrange a meeting for a meds check. It's free. You can do it once a year. And then you have the chance to ask for details, okay? In terms of taking the medication, what is important to highlight? So take them as prescribed, okay? Try to avoid abruptly stopping them. And if you need to stop, we strongly recommend you to first talk to a cardiologist, talking to your doctor, your family physician, your cardiologist, or talking to the pharmacist, okay? Don't stop medications without talking to a healthcare provider that can advise if it's safe or not. And another thing, sometimes it's too many pills, and you can talk to the pharmacist so they can have a plan. For example, here, you can ask them to organize in blisters, so it will have morning, afternoon, and so on, and it can really help people to take the pills to be more organized, to not forget things, so it's really important. Another message here, if you're thinking about traveling, don't forget to bring enough medications, okay? So really plan ahead. It's very important. Make sure you bring enough medications. Try to have them on your carry-on bag. It's extremely important. And always carry a list of your medications. So, and this last message, I would say it's not only when you are traveling. I would say it's always, okay? Always have your list of meds with you, because if by any chance you need to let someone know if something happens to you and the people are not, the doctors are not able to check what you are taking on the system, then it can really be helpful in terms of improving the care that we provide if we know exactly what you are taking. Okay, so finally, if you want more information, go to our cardiac college and click on the Take Control tab for the online tools. So it's on the left side of your screen, and then you can see here toolbox, and then you can access the taking your heart medicines, and you can have it on your computer, and you can study and take a look to the full list of medications, and it can be really helpful. Okay, so what we hope you learned today. I hope you now know some common classes of heart medications. If you already knew, I hope you will learn something from today, something else. And I hope you have now more resources that can help you to manage your medications. So if you want, I would say that it's extremely important to be aware of what you are taking, the dosage, and how often you are taking. And if you have any questions why you are taking these medications, talk to your doctor, to your pharmacist, to a nurse practitioner, or another healthcare provider that can support you and help you to learn more about it. Okay, great. So now it's time for the questions and answers. We have someone here that missed the last session, and we will check, but it will be available on YouTube for sure. Same thing for today's presentation, okay?
So Dr. Carvalho,
Yeah,
it's Tracy here. I thank you for the excellent overview, thorough overview of medications. And I just have a quick question just to clarify around the meds check.
please.
So this is offered once a year by your pharmacist, and what specifically do they go through? The indications, maybe kind of just outlining a bit more what the pharmacist will go through with patients when you go for one of these sessions.
Thank you, Tracy. It's a very important question. Yeah. So often when I'm trying to check the medications that our patients are taking, we often see some disconnection between what has been prescribed and what which medications the patients are really taking. Because sometimes it's too much, sometimes there is not a very well organization in terms of which time the medications can be taken. So the pharmacist can sit down with the patient and can see if there is a way to put together medications at the same time, so it will be easier for the patient to take them. Just an example. Another important thing. So it's very important to check if there is any interaction between the medications, especially medications that are not cardiovascular medications. So this professional, the pharmacist, can check, for example, if supplements that people sometimes take and think that, oh, it's natural, it's okay, but sometimes they interact with the cardiovascular medications. And I always recommend my patients to talk to the pharmacist, because he or she is the best person to advise in this regard. There are other things, so they can also check, as I mentioned, dose, if the dose is correct, how often the medication has been taken, and also they can check if a blister can be done instead of taking the medications in different bottles. So they can organize in those blisters, and then there will be morning, afternoon, night, or other periods if it's necessary. And then it can be really helpful, especially for patients that are taking too many medications, to not to forget them. So I think, and there are other things that can do for sure. Even if sometimes, let's say there is a side effect, the pharmacist can advise also in this regard. Okay. Does it answer your question, Tracy?
That's great. Thank you.
Okay. So there is someone asking here, what precautions should you take when taking a beta blocker? Okay. So, and also there is another question that I can briefly mention, I would say together, about the hot weather. So it's really good questions, especially now during the summer. We have a lot of patients that don't drink enough water, okay? And because they are taking cardiovascular medications and you are encouraging them to exercise, it's important to be hydrated, okay? So talk to your doctor, check if there is any restriction in terms of liquids. If you have heart failure, for example, maybe there is a restriction and then you need to follow that. But if there's no restriction, between 2 and 3 liters may be necessary every day, or sometimes more, if you are exercising outside and sweating a lot, okay? What may happen if you're not well hydrated? You may lose a lot of water, and then your blood pressure may or may not decrease. But especially when we are standing up quickly, let's say you are sleeping and you need to go to the washroom during the night, and then you suddenly go to the washroom, then you may feel lightheaded and you may feel dizzy, and sometimes you may fall. So it's very important to be hydrated, and that's one advice. Regarding the beta blockers, so usually if the dosage is correct, so I would say just being well hydrated, controlling and regularly checking your pulse, as our cardiovascular rehabilitation supervisors here recommend. So if you are tracking your heart rate and it's normal, so it's fine, it's okay. That is, I would say, no specific recommendation in terms of, because you are taking the beta blocker, okay? What is important to know is that some medications that are not for the heart can interact with beta blockers, and then it can exacerbate the effect of a beta blocker. So that's why it's so important to talk to your doctor, bring the full list of medications that you are taking, and also it's an option to talk to the pharmacist just to check if there is no interaction, in this case exacerbating the beta blocker effect. Okay. So I hope it answers the questions. Okay. Something else that I can mention about the beta blockers that people sometimes have this concern is that the heart might not respond when it's necessary, right? Because it's decreasing the blood pressure or the heart rate. But we need to see the other side of this, because it's not exactly like this. So the beta blocker is actually helping your heart to pump better, okay? So when you decrease the heart rate, you're giving some relief for the heart. And at the same time, if it's pumping very fast, there's no time for the chambers to fill up with blood. So at the end, you may have less blood going to the body. But if we have more time, if the heart rate is slower, So this heart can work more in more harmony, and then the chambers can be filled up with blood and can bring blood to the whole body in a more elegant and efficient way. When there is a problem, of course, I'm not talking about people that don't need a beta blocker. So this is some special things, details about beta blockers. I hope it has answered the questions. If not, I'm very happy to address them. Just leave on the Q&A and we can see them later. Tracy, do you have any other concern or question I'm willing to answer?
Sure. One other question I know from patients that I've heard is when they're on blood thinners. Mm-hmm. And in our program, any recommendations for, you know, their activity and exercise when they're on blood pressure or when they're on anticoagulants or blood thinners that they should keep in mind when they're exercising?
Yeah, so this is also a very good question. I will divide here in three. So we have what we call blood thinners, aspirin, and usually it's not a concern. Some people may have more bruisings, and it may not be beautiful for some people. They really think that it's annoying, and we understand that, but it's a sign that the medication is working actually. Okay, so it's not to be worried if you're just taking aspirin. But if you're taking in terms of exercise, so if you are taking the other medications, and now I'm talking about clopidogrel, ticagrelor, warfarin, and the new anticoagulants like rivaroxaban, then the risk of having bruisings are greater. And also, what is it? So when you hit your arm or your leg, everyone once in a while have a bruising, right? But if you're taking blood thinners, so it may take more time for that vessel to stop bleeding, okay? Because the bruising is the bleeding under the skin, right? So if someone, for example, is playing soccer and there is a ball that hit the skin, the leg, the arm, so it may take longer and then the bruising will be bigger. So this is a concern, especially if you're playing something more intense, let's say hockey, okay? People can really get hurt. So that's why we don't recommend high impact sports or activities for people taking blood thinners. Another thing, and this is our main concern. If someone falls, let's say skiing, and hit the head on the floor, same thing. If this person is taking a blood thinner or an anticoagulant, specifically speaking now, the chances of having a hematoma or a big bruising in the brain is bigger, right? Compared to someone that is not taking it. So that's why it's so important. And we recommend cautious and talk to your doctor, check what they recommend to you. What is your risk of bleeding? Because it's something else. Depending on some details about you, you may have a higher risk or a lower risk of bleeding. So depending on all these factors, we can advise in terms of which sports or which activities can be done. But generally speaking, high impact, hockey, high profile skiing, this kind of activities we do not recommend. It should be avoided for those taking anticoagulants, okay? I have a patient that asked me, okay, but can I ride my bicycle? I said, of course, if you're not going to go down the hill like crazy, and if you are using your helmet. So we need to carefully analyze each detail, but yes, you can ride your bicycle, okay?
Great, thank you. I'm thinking about, like you say, with moderation with exercise, for patients, especially I'm just thinking in the heat. So those questions around the heat were really, really appropriate for the weather we're having right now. As far as I know, another question I often will get from patients is that, will I be on all these medications for the rest of my life? I'm sure you've heard that many times as well.
Yes, Tracy, it's again a very good question. So let's say you had a heart attack, or a patient had not a heart attack, but there was a coronary bypass surgery or a PCI, so some kind of intervention, right? So we understand that if it happened, it's because there was a higher risk for building up plaques in the coronary arteries, right? For some reason, different reasons, different cardiovascular risk factors, but it happened, okay? And we needed to do everything to prevent another plaque to build up or to rupture. And I'm talking about to prevent a heart attack. We need to also remember that we are talking a lot about heart, but what is happening in the coronary arteries is also happening in the brain. And we can think that stroke, the ischemic stroke, is very similar. Sometimes it's there, the plaque. Sometimes the plaque is here in the carotid arteries, but it goes to the brain and causes damage, the stroke. Okay. So coming back to your question, if that person has just higher risk, it's not because we are doing a bypass surgery or putting a stent that the risk has gone, right? We needed to do everything to assure that it's not going to happen again. And that's where cardiovascular prevention and rehabilitation comes. So we know that medications are just one part of that. We also needed to do to improve exercise, diet, stress management, many other things. But regarding medications, some of them will be forever. And we are talking here for this specific group, cardiovascular coronary artery disease. We are talking about the baby aspirin and potentially the cholesterol pill. Why I'm talking about these two medications? Because we saw the plaque building up, right? And it's happening. Just age is a risk factor for that to happen. So you needed to do everything to prevent that to happen. And we know nowadays that cholesterol pills and the baby aspirin after a heart attack, together with the medications that I mentioned, the ACE inhibitor, and also I would say just 3 medications, and there are other specific cases for other medications, but they can dramatically bring the cardiovascular risk down. It can dramatically decrease the risk of a new heart attack and a stroke. So what I usually think, and I tell my patients, before it has happened, the stent or the surgery, you were not taking medication, so the plaques were building up. But now you are taking, so I see the patient as protected. Of course, not 100%, but we know that it can decrease the risk. And you also know that the more these medications are taken, the more, in terms of timing, the better is the effect and the protection. It has been well proven for ACE inhibitors, for example. So if you're taking for 1 year, it's different if you have been taking for 10 years. So it's not true that your body will get used to the medication and it will decrease the effect. No, it's a misunderstanding, okay? What is true is that if you take, for example, ACE inhibitors for a long time, it will bring your risk of cardiovascular issue down, and this effect is accumulative, okay? So usually I tell my patients, yes, it's forever, but think that you are, some medications are forever, but thinking that from another perspective, now you are protected. And in terms of blood pressure and diabetes, the good news is usually with lifestyle intervention, I'm talking about essentially diet and exercise, losing weight, we can definitely help these patients to decrease the number of medications that are needed to control the blood pressure, to control the diabetes. And in some cases, these patients feel, it's not so often, but they can sometimes get rid of the medications, okay? I think these are the most important situations that I would mention in terms of examples of medications.
Thank you very much, Carolina. I don't see any other questions in the Q&A. I think we can feel free to close our session. I will turn it over to you.
Okay, Tracy, it was a pleasure to be with you. Thank you.
Thank you again for your time and for sharing your expertise.
So thank you for watching us, and I hope you have learned something. And we will not be here next Tuesday, but we will be back on August 11 at 10 a.m. Okay? So thank you so much. Stay safe and bye.